Hello, a very good morning to one and all. I'm Dr. Shrutika. I welcome you all back to our new YouTube video today. So our today's YouTube video is on nutrition and health. This is a very quick revision video on nutritional requirements and along with that nutritional deficiencies and how to quickly and easily remember them for any sort of competitive exams that you are preparing for. Now, the first thing is iron supplements or iron requirement in our body in men, women and pregnancy. So the iron requirement during for an adult man is 17 mg per dl. For women it is 21 mg per dl, and for pregnant lady it is 35 mg per dl. Now whenever we're talking about mg, we are talking about milligram. Very important. Always remember this. Folic acid. Now the folic acid requirement for man is 500 mcg per dl in this is the folic acid. This is during pregnancy, and during the adolescent period it is 400 mcg per dl. Now whenever we are talking about mcg is microgram. Okay, mg is milligram and mcg is microgram. I hope this query is cleared out here only. So the folic acid requirement. So जब भी कोई lady pregnant होती है, we give her 500 mcg की गोली चालू करते हैं of folic acid. Now talking about the calcium. Pregnant and during the lactation period, we need 1200 mg per dl of calcium supplementation. Now about the adolescent, we need 600 mg per dl. Now vitamin A supplement. Now vitamin A in adolescent age or in adolescents we need 600 mg per dl. That in infant we need 350 mg per dl. Now talking about the fluorine, we need 0.5 to 0.8 ppm. Very important. It is most commonly asked. And zinc requirement is 10 to 12 mg per dl. Vitamin C is 0.03 mg per kg per dl. Very important. Iodine. The requirement of iodine is in adults is 150 mcg. That in pregnant lady is 250 mcg, and that during the lactation period is 220 to 290 mcg. Very important. So in a short, the nutritional requirements that we saw is iron, folic acid, calcium, vitamin A, fluorine, zinc, vitamin C and iodine. Very important. The biggest difference between mg and mcg is milligram and microgram. Going up ahead, let's talk about nutritional deficiencies in a quick way. Now vitamin A. Vitamin A is the most common type of deficiency. So there are two types, that is primary and secondary. Now in primary, what signs and symptoms we would see in order to diagnose it as vitamin A deficiency? Now there is xerophthalmia, conjunctival xerosis. Conjunctival xerosis is the first sign of vitamin A deficiency. What is the first sign of vitamin A deficiency? It is conjunctival xerosis. Then Biot's spot. It is the most specific sign. Very important. Corneal xerosis, corneal ulcer and keratomalacia. And second type, or in the secondary thing, the symptom that we get to see is night blindness. So night blindness is the secondary symptom of vitamin A deficiency, but primarily once you see the patient and you get to see Bitot spot, it confirms your clinical diagnosis. Now vitamin B1 deficiency is known as beriberi. It is known as beriberi, that is polished rice eater. It is seen in, now vitamin B1 deficiency is very commonly seen in Wernicke's psychosis. Very important question. And what is the name of vitamin B1 deficiency? It is known as beriberi. Now vitamin B2 deficiency is known as riboflavin. The name of vitamin B2 is riboflavin. And what are the important signs or symptoms we see in vitamin B2 deficiency is angular stomatitis, cheilosis plus atrophic glossitis, that is mapped tongue. मुंह में छाले आ जाना is the most common sign of vitamin B2 deficiency. Now vitamin B3 is niacin. Now talking about niacin, it is known as Pellagra. Deficiency of vitamin B3 is known as pellagra. What are the 3 Ds? That is dermatitis, dementia and death. The 3 Ds of pellagra are dermatitis, dementia and death. Castles seen in B3 necklace deficiency. Okay, vitamin B3. Going up ahead is vitamin B6. What is the deficiency of vitamin B6? It is microcytic anemia plus peripheral neuropathy is vitamin B6. Now vitamin B9 is megaloblastic anemia plus neural tube defect. Then about the vitamin B12, most common type is peripheral neuritis, megaloblastic anemia plus pernicious anemia is vitamin B12 deficiency. Vitamin C deficiency is known as scurvy. Vitamin D deficiency is known as rickets or osteomalacia. You can get this in terms of match the following or true or false or in any way in any competitive exam that you are preparing for. You need to know this कि vitamin C deficiency को scurvy बोलते हैं, vitamin D deficiency is rickets and osteomalacia. Selenium deficiency, very important. Selenium deficiency is seen in endemic areas, so it leads to endemic cardiomyopathy, and with selenium deficiency is also known as Kissan's deficiency. Kissan's deficiency. Now going up ahead, deficiency of essential fatty acids. Deficiency of essential fatty acids is known as phrynoderma, that is toad like skin. ऐसे ऐसे छोटे 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 दाने आ जाते हैं स्किन पे, that is known as phrynoderma, that is toad like skin. Zinc deficiency is acrodermatitis enteropathica. Now, chromium deficiency is improper glucose tolerance, and vitamin E deficiency is progressive and external ophthalmoplegia. Now, let's quickly talk about food adulteration, very important. Letharism. Letharism is because of which food adulterated? It is kesari dal. The orange color dal that you get to see in ration is kesari dal. The mnemonic to understand is BOAA, that is a toxin which is present in dal. It affects humans and animals in 2 ways. This BOA would be affecting humans by producing neuroletharism, that is it will affect the nervous system, and in animals it will affect the it will create osteoletharism, that is it will affect the bones. So in humans you have neuroletharism and in animals you have osteoletharism, and the toxin which is present is BOAA. Now, epidemic dropsy. Epidemic dropsy is caused because of argemone oil plus mustard oil. So, this argemone oil and mustard oil gives rise to sanguinary toxin which is produced, leading to epidemic dropsy. Now, endemic ascites is caused because of Crotalaria. Ergotism caused when persons consume claviceps, and alpha toxicosis is because of aspergillus. But the most important thing that you need to know is about letharism and epidemic dropsy. Quickly, let's understand about pasteurization of milk. What are the 2 ways of pasteurization of milk? Holder's method and flash method. Now, Holder's method, in which we boil the milk up to 63 to 66 degrees Celsius for 30 minutes. And that is what we know called as Holder's method. Second is flash method. In flash method, high temperature around 72 degrees Celsius for short time for 15 seconds. To check sufficiency of pasteurized milk, we use phosphate test. To check the sufficiency of pasteurized milk, we use phosphate test. So what we understood in today's video was about the nutritional deficiencies. We understood about the nutritional requirements. Then we understood about the nutritional deficiencies pertaining to different vitamin deficiencies. Along with that, we understood about food adulteration and pasteurization of milk. If you find this video useful, do not forget to share it amongst your friends who are preparing for competitive exam. Do not forget to subscribe to my YouTube channel. Your queries and questions are always most welcome to me. You can post your queries into the comment box, and what upcoming new video you want me to make, you can comment it in the comment box and let me know. Keep learning, keep sharing. Thank you.